Between November 1864 and August 1866, Florence Nightingale was in Constantinople, treating British soldiers wounded in the Crimean War. Nurses were on the front line, faced with the cholera and typhus epidemics. This 34-year-old woman, from a wealthy British family, brought in new methods. She insisted upon strict levels of hygiene and tended the wounded day and night.
Nightingale wanted to work and save lives. This was a matter of faith for her. She was following a mission. You don't follow a mission to get personal gain. You follow a mission to achieve the goals of the mission.
Upon her return to England, she was a heroine. The press sang her glories. Even Queen Victoria paid homage to her. Her Crimean experience gave her the necessary authority to tackle the pervading conservative mood.
I think it fired her imagination in ways that would have been unimaginable, and her motivation to come back and reform the British military health of soldiers and hospitals.
A social reformer and pioneer, Florence Nightingale transformed hospital care, affirming the importance of the nursing profession and the status of women in society. Generations of caregivers were to follow in her footsteps. Her legacy still lives on today. In 1857, Florence Nightingale set to work in a room at the Burlington Hotel, London. The British government had commissioned a report from her concerning shortcomings of army hospitals during the war. For several months, she set about compiling her own data, alongside that of doctors and administrators. This room became her little war office. In Constantinople, she'd noted the number of deaths, contagious diseases, and which regiments were most affected. Even soldiers' food rations had been analysed.
It cannot be denied that a large part of the British force perished from avoidable causes, and not necessarily the direct results of war. 10,053 men perished in 7 months from disease alone, upon an average strength of 28,939. This mortality exceeds that of the Great Plague.
These notes allowed her to draw up diagrams and to determine the mortality levels reached in several military hospitals during the war. Florence Nightingale believed in the value of statistics. They were to be her great strength.
Not more than 61% of the nominal force on the plateau before Sebastopol were fit for duty. To keep up an army under such circumstances would require 164 men to supply 100 men for duty. A siege conducted on such principles requires 2 armies, separately organized, one to combat the enemy and another to combat disease.
The ordinary soldier, I mean, that was the main population with whom she really identified. She was very dismissive of military authorities who were in charge. Obviously, they were doing a very poor job. She had some capacity to actually make a difference.
The figures in her report were heavily critical of the military medical system. For Florence Nightingale, nothing in the administration of army hospitals was working. It needed to be completely rethought.
It became a 2-year study of 853 pages, and a fabulous study it is. It's so detailed. It's got the numbers in it. It's got the documents in it. It's got the correspondence. It says who reported what went wrong and who did something about it when, and shows the horrible delays. It has charts in it. It has tables in it. It's a very thorough report. That's where she was putting her time. She didn't want to be famous. She wanted to get on with analyzing what went wrong and how to do it better.
The impact of her report confirmed her legitimacy. In 1858, Florence Nightingale was the first woman to become a member of the prestigious Royal Statistical Society. She became a public personality. She was 38, with the necessary authority to try to change people's lives.
Her greatest experience was how to improve the public health. But she went on from her understanding of improving the health of the soldiers in the Crimea to improving the health of the people who lived in the downtrodden areas in London, in the city.
Ever since her childhood at Lea Hurst, contact with poverty had strengthened her vocation. The Industrial Revolution, which overtook England, brought a great deal of misery and social injustice with it. Many neighbourhoods were overcrowded slums, a fertile environment for all forms of epidemic. Identification of germs and the notion of antiseptic surgery had not yet left the laboratories of Louis Pasteur or Joseph Lister, but research was promising. Florence closely watched developments. She was drawn to the emerging hygiene hypothesis, which recommended public health policies relating to both medical research and personal hygiene, focusing on quality of habitation and healthcare environments.
She was in conversation with the sanitarians, Edwin Chadwick, the great public health, reformer and sanitarian. So she was part of a kind of coterie of doctors who were very deeply interested in this, and they all subscribed to this sort of basic tenets of hygiene.
She was like a sponge of information. She absorbed everything that she needed, and she did that unashamedly, I would suggest.
Having tackled military hospitals, Nightingale turned to public hospitals, where she considered the quality of caregivers to be fundamental.
She was putting this knowledge to work and to practical benefit, and then ultimately through nursing. Nursing is a vehicle to impact the health and health outcomes and welfare of the working class population.
Familiar with the London hospital environment, Florence met with Sarah Elizabeth Wardroper, a strong-willed matron who shared her principles of hygiene. Together, they created the British Empire's first training school for nurses at St Thomas's Hospital in London.
It was the first in the world, and nurses simply had not been trained before. And Nightingale always believed that nursing had to advance with medical science and with healthcare. When it started, nurses were not even allowed to take a temperature of a patient. That was done by junior doctors. Nightingale accepted that. It's a foot in the door, we're in the hospital, the school is going. Then gradually, nurses were doing all kinds of things which required elaborate technical training.
20 to 30 students enrolled the first year. They lived at the school, working 8 hours a day, 7 days a week. In order to apply, they needed to know how to read and write. They alternated between theory courses in anatomy, physiology and pharmacy, and practical courses at hospital bedsides. Their mission was to become caregivers.
Florence Nightingale particularly emphasised the need for hygiene, both physical and moral. Doctors were there to treat, nurses to provide care. There was a global approach to the person, and students were required to practice sport, to eat correctly, and take sufficient rest. Time was allocated every Sunday for sports.
I think she was quite keen to see women who could attune to hard work. And that was not women of upper class bearing. Their fathers were farmers, engineers, some from medical kind of backgrounds. But that was a positive thing because, again, nursing was very, very hard work, physically and psychologically.
She believed her school should be open to women of any religion or none at all. And that was important to her, that this would be a secular profession that you entered on the basis of training.
Every day, sanitary knowledge or the knowledge of nursing, or in other words, of how to put the constitution in such a state as that it will have no diseases, or that it can recover from disease, takes a higher place. I do not pretend to teach women how to nurse. I ask them to teach themselves. And for this purpose, I venture to give them some hints.
To guide this first generation of nurses, Florence wrote a book, Notes on Nursing. It included all the aspects which she considered essential for caregiving.
Applying a dressing is technical. Applying a dressing for someone in a particular context is where it becomes the work of a caregiver. This notion of care is particularly interesting and something which we have perhaps lost. We're still at the technical level of care, whereas care in all its dimensions is at the very heart of our profession.
With Notes on Nursing, the 19th century English pioneer laid down the ethics behind the notion of care in all its dimensions. It's a concept which brings together technical practices, empathy, and consideration for the patient. Over the course of the 20th century, this ethic was to take on considerable dimensions.
Notes on Nursing certainly sold very well, was translated into many languages, and then, of course, there were a number of different versions of it. There was Notes on Nursing for the laboring classes, which used simpler language again, but it also had more on childcare, and that was a very popular edition.
A few months after being published in England, Notes on Nursing was taken up by a publisher in New York. Nightingale became known all over the East Coast of America. When the United States plunged into war in 1861, Abraham Lincoln's Union Army naturally called on her expertise. This war was waged between the Union Army in the north and the Confederates in the south. The former wished to abolish slavery and support democracy. The latter wished to maintain white supremacy, using slavery as an economic foundation. The American Civil War was to be the deadliest conflict in American history. Fighting brought about 617,000 casualties, and the military hospitals were completely overwhelmed by the arrival of the wounded.
The American Civil War had a very high death rate on both sides, and Nightingale's material was used in it, particularly by the Northern Army, and she got the material together, the forms that had been used to help organize hospitals in the Crimean War. She made sure that they got that.
We are happy to see that the system of pavilion hospitals is beginning to attract attention in this country. The Committee of the Common Council have adopted the plan of pavilion hospitals now so generally preferred abroad and so highly recommended by Miss Nightingale.
During a visit to Paris, Florence Nightingale had been struck by a new pavilion hospital at Lariboisière, built in accordance with hygiene theories of the 1850s.
The best principle of hospital construction is that of separate pavilions placed side by side or in line. The distance between the blocks should not be less than double the height.
Her new work, Notes on Hospitals, was an in-depth study of construction methods and layouts for hospitals. Her plans for pavilion hospitals for the Americans were the avant-garde of military and civilian hospitals in Europe. She recommended construction in several blocks in order to isolate patients according to their pathologies. The wounded on one side, those with infectious diseases on the other.
She had this huge kind of helicopter view of health systems and how they should kind of function and how hospital buildings should be designed to promote this sort of circulation of air to prevent infection.
Florence Nightingale wanted her advice to help both camps, as long as it saved lives. Her grandfather, William Smith, was a British MP and abolitionist. But in the North American conflict, she refused to become involved in politics.
And Nightingale certainly believed her material should be used on both sides. She was certainly for the abolition of slavery, but you don't wish death on Confederate soldiers either. She thought that if her material had been better used, that their death rates could have been lower.
She suggested mobilizing women to help out military doctors. Volunteers flooded into the combat zones from all over the country. Described as nurses, they were to distinguish themselves in emergency situations and discover their vocation. In April 1865, at the end of the conflict, in which Unionist values won the day, the country was traumatized. Reconciliation and reconstruction were necessary. This reconstruction included a reform to the health system and new hospitals. American nursing first began in New York, just after the shock of the Civil War. In 1873, Bellevue Hospital created the first school founded upon Nightingale's principles. Shortly after, another was founded on the same model in Boston, the Waltham Training School. The Nightingale schools multiplied in the UK. They inspired American philanthropists who insisted on recruiting English matrons to teach their contingent of nurses.
The protégés from the Nightingale School would sometimes be the leaders of other schools throughout the country. So there was this kind of diaspora of leading matrons from the stem cell school of St. Thomas's. These people carried the kind of Nightingale torch, if you like, but they had to find their own way. They had to really improvise and create and craft a curriculum.
This pioneer left her mark on America. Over the years, thousands of students were to enroll in the nursing schools, which sprang up all over the country. Future nurses took the Nightingale Pledge, an oath to validate their training before beginning professional life.
I solemnly pledge myself before God and in the presence of this assembly to pass my life in purity and to practice my profession faithfully. I will abstain from whatever is deleterious and mischievous and will not take or knowingly administer any harmful drug.
Inspired by the Hippocratic Oath taken by doctors, the Nightingale Pledge was proof of high standards, both professional and moral. Values dear to Florence. Back in the UK, she knew that her ideas had spread far beyond her expectations.
Obviously, she was a feminist in terms of our language. But for one thing, she started the first profession for women in the world. That you could join the profession by training, that there would be job possibilities with promotions and pensions and job security and benefits on the job. I mean, this was the first time that this was possible for women. So that was enormously important.
If there exist today in the United Kingdom thousands of nurses and schools attached to almost every hospital, and these hospitals benefit from a large workforce which is skillful and agreeable, this wonderful result is thanks to the way in which reform began, to the intelligent and capable woman who organized the first school at St. Thomas's in London.
Since her first nursing school, Florence Nightingale had not stopped working. She was consulted upon more or less all questions of public health and hospital reform. But she was hardly able to leave home anymore, her body being weakened by brucellosis.
She herself became ill while she was in the Crimea, probably brucellosis. She nearly died then, around like 1862. She was then very much confined to her rooms. She says in her letters sometimes, I'm a prisoner to my room. Sometimes she says, I'm a prisoner to my bed. She did have a very small number of outings, but basically she worked around her disease. When she could do things, she did. Nowadays, it's a disease that would be treated with antibiotics, and it would be no worse than a mild flu.
Despite illness, she transformed her salon into an informal policy bureau. From her house in South Street, she reformed the health system in India and advised the British Army during the Anglo-Zulu War of 1879, then the Egyptian campaigns of 1882.
And she influenced people around the world. People from around the world came to see her about starting hospitals, starting nursing, and so forth. She wanted nursing to expand to every country and every hospital. She had to work mainly by paper, by writing things down. She worked all the time. She didn't believe in taking Sundays off.
Her doctor complained that she was overworking, but Florence continued to follow all the relevant events of the period. She was even consulted by Henry Dunant, the famous founder of the Red Cross, who had great admiration for her. He claimed her work in Crimea had inspired the creation of his organization.
The relationship between Nightingale and the Red Cross is certainly a complicated one. Nightingale was worried, as were other people, that if you slough off the work of looking after sick and wounded soldiers onto volunteers, there are negative consequences.
You might say that Henry Dunant launched the Red Cross as two segments. One aspect was practical action, how to treat, to evacuate, etc. And the other, the idea that this was to be a neutral force, which didn't take part in fighting, and upon which you did not fire while they were in the field evacuating the wounded. All these conventions and methods needed to be perfected.
For Nightingale, states needed to assume their responsibility, care for their soldiers and organize their military hospitals, not charities. This was her reply to Henry Dunant. It was too risky to relieve governments of this essential duty.
The army should look after its own sick and wounded and should prepare to do that. And if you let them get away with not doing it fully, this is very unhealthy.
Despite her reserves concerning the Red Cross, the charitable organization was to become a mainstay of armed conflict. Red Cross societies were formed all around the world. They never failed to pay homage to one of their muses, the Lady with a Lamp. This even reached Japan, where Nightingale was assimilated into Kuan Yin, the Buddhist goddess of mercy.
There are very good reasons for admiring Nightingale, because she actually did clean up the war hospitals. People survived thanks to her care. And the Red Cross wanted to carry on in this tradition in a voluntary manner.
In 1912, the International Committee of the Red Cross created a medal to be awarded to nurses who had demonstrated exceptional courage and devotion. The Australian, Hester McLean, was the first person to receive it. The Florence Nightingale Medal is still the highest international distinction that a nurse can attain, a sort of Nobel Prize that everyone dreams of receiving.